We're going to be starting in a minute, so please take your seats. Good morning. Welcome to the Central Library of Rochester and Monroe County and today's conference on the mid-sized American city in the 21st century. This event is being live streamed and recorded. I'm Christine Radarski. I serve as the Rochester City Historian, Director of Historical Services for the library, and co-editor of the Rochester History Journal. We would like to start today's program by acknowledging that we are meeting on the ancestral lands of the Onondaga, or Seneca people, who along with the Cayuga, Mohawk, Onondaga, Oneida, and Tuscarora make up the Haudenosaunee Confederacy. We pay respect to their elders, past and present. Please take a moment to consider the many legacies of violence, displacement, and migration and settlement that have brought us together as a community. May we strive toward reconciliation in our efforts to collaborate more humbly and genuinely to create diverse and equitable communities in which all can flourish. Today's event reopens a conversation begun 21 years ago when then Mayor William A. Johnson Jr. convened the Rochester Conversation on Mid-Sized Cities. Mayors, academics, urban policy experts, and others gathered to discuss the challenges that were facing the urban centers that occupied the poorly understood middle ground between towns and metropolises. Such Rochester conversations have an even deeper history in the pages of the Rochester History Journal. My esteemed predecessor, Dr. Blake McKelvey, launched the journal in 1939. At the time, it offered a new model of urban history that encouraged Rochesterians to reflect on their city's present and future by more rigorously examining its past. Today's conference marks a re-envisioning of the Rochester History Journal through a partnership between the library and RIT Press. The latest issue of the journal, and the first to be published through this partnership, is available at the RIT Press table at the back of the room. So if you're not already a subscriber, please consider purchasing a copy and subscribing today. Throughout the day today, and continuing in future issues of the journal, we hope to inspire new conversations about the meaning of America's mid-sized cities, now and in the future. Before we get into our first session of the morning, I would like to take a minute to acknowledge the people who have made today's event possible. First, we would like to thank WXXI for helping to promote this event as our media sponsor. We would also like to thank the College of Liberal Arts and the Wallace Center at RIT for their support of the Rochester History Partnership and this conference. We, of course, want to thank the staff of RIT Press for their work on this journal. And we want to thank editorial assistant and RIT History and Museum Studies major Caitlin McCabe, who most of you probably met when you came to the registration table today, and also senior staff assistant Peggy Knoll for their work organizing this conference. And last but not least, I want to give a shout out to my fellow program planning committees members. Emily Morey will be with us this afternoon and leading the walking tour. Michael Brown, do you all want to give a wave? Michael Brown, Tamar Carroll, Rebecca Edwards, and Richard Newman. And finally, just a few housekeeping issues. Please take note of the emergency exits, the main exits behind you. There's an exit over here, out into the reading garden, and behind me. Gendered restrooms are located in the hallway to the left of the auditorium's main entrance, so that's over this way when you exit. And we have gender-neutral restrooms available in the Technology Center one level below us in the link level. And now I would like to introduce Tamar Carroll, Chair of RIT's Department of History, who will be facilitating our first panel session. Tamar.
Thanks so much, Christine. And thank you to the Rochester Public Library for hosting this event today. I'm going to introduce our three speakers for this panel on gender and the mid-sized city, and then they'll each speak for about 15 minutes, and then at the end, we'll take questions from the audience. It's my pleasure to introduce Elizabeth Carr, a second-year history PhD student at the University of Rochester, who has a bachelor's degree in museum studies and digital humanities and social sciences from RIT. Lizzie's research focuses on the intersection of museums, public history, and digital technology, and how these can enhance people's engagement with the past. Her professional experience includes museum and archival work at the Museum of the City of New York and the RIT Archives. Her digital projects include Gatsby's Gold Coast and developing a digital archive for the nonprofit First Peoples Fund. Corinna Schloms is Associate Professor of History at RIT, where she teaches classes in the history of information and communication technologies, modern German history, and gender and sexuality studies. Her book, Productivity Machines, examines the transatlantic history of productivity technology and culture in the 2 decades before and after World War II. Schloms also publishes on computing and gender. She is now working on a history of women's labor and data entry with funding from, among others, the National Science Foundation. Serenity Sutherland is Assistant Professor of Communication Studies at SUNY Oswego. She is a graduate of RIT's Environmental Management and Technology program. Since then, she received her PhD at the University of Rochester, and her research interests include the history of women in science and technology, media studies, and the digital humanities. She was the project manager of the Seward Family Digital Archive, a Mellon Fellow in Digital Humanities, and is currently a member of the NHPRC and Mellon-funded Primary Source Cooperative, a publishing platform for digital education, for digital editions. She is the editor of the Ellen Swallow Richard Papers and is working to publish a biography of Richards, a chemist who was the first woman to attend and teach at MIT. She also co-published the Digital Humanities Project, Visualizing Women in Science at the American Philosophical Society. Please join me in welcoming Elizabeth Carr.
Thank you, Dr. Carroll, for the introduction, and to the conference organizers for putting this together. Good morning, everyone. For many people, access to safe and reliable birth control is viewed as a necessity rather than a luxury. This is true across a wide spectrum of demographics, but obtaining this aid can be affected by different factors. Socioeconomic status in particular plays a role in how accessible birth control devices and services are, but this is not a new phenomenon. Beginning with Margaret Sanger's Brooklyn Clinic in 1916, services designed to provide lower-class women with access to birth control and family planning services have spread across America, with Planned Parenthood operating many of them. Today, Planned Parenthood clinics provide a number of services related to sexual health, but the earliest clinics often provided only birth control devices and methods, and specifically aimed to help those who did not have the financial means to access them elsewhere. In Rochester, the first birth control clinic opened on February 21st, 1934. By the end of 1939, it had already assisted over 7,000 women in Rochester. Many of these women were likely Catholic immigrants from Italy or Ireland, and all of them could be categorized as lower class. The assistance these women received profoundly affected their lives and allowed them a level of control over their fertility that was previously inaccessible. In its early years, the clinic was mostly volunteer-run and subsidized its operating costs through fundraising and donations. It was not until the mid-1940s that it became affiliated with the larger Planned Parenthood Federation of America and the New York State Planned Parenthood Federation organizations, meaning that all the initial work of forming and operating the clinic was completed by Rochester locals. The early organizers, who were predominantly from the city's middle and upper classes and were almost all women, solicited funding from people of a similar privileged class and spent significant time and effort working for the clinic. In this way, the clinic was a local movement from its beginning, with organizers from Rochester striving to assist those who lived in their city. The clinic's local origins, however, did not mean that Rochester was unaffected by larger trends in the birth control movement during this time. Nationally, many promoters of contraceptive access had less than altruistic motivations. Many people both within and outside of the movement, most notably Margaret Sanger, held eugenic beliefs of stopping those who were, quote, unfit from having children. Sanger founded her clinic in part to satisfy these ideals, and literature from the time reflects how pervasive eugenic thinking was among people involved in the movement. Also notable on a national scale was opposition to birth control practices from certain segments of the public, particularly the Catholic Church and its members. At a time when a significant part of America's lower class consisted of immigrants from Catholic nations, this rejection by church authorities could prove a strong deterrent against seeking family planning services. Rochester adhered to some of these national trends and diverged from others. The community organizers dealt with church opposition at a local level, but were less caught up in the eugenic wave sweeping the nation. They were concerned about birth control accessibility for the lower class, but not with stopping them from having children altogether. Prior to being linked with Planned Parenthood around 1945, the Monroe County Birth Control League was doing on-the-ground work to aid those in their city who needed it most, and had the authority to set their own rules for how to best accomplish these goals. Although Rochester's birth control clinic followed national trends in the types of devices prescribed and the populations it served, they differed in their motivations for providing aid and in the way they handled opposition. These discrepancies raise question of how national these larger trends really were and suggest a need to consider and study birth control history at a regional level. In 1930s America, birth control was becoming a widely